So this is a sample neuro nursing assessment, and this is my patient. Thank you for volunteering. I've already washed my hands and applied gloves. So hello, my name is Anush. I'll be your nurse today. How are you feeling?
Good.
Great. Do you have pain anywhere?
No pain.
Excellent. Can you tell me your name, please?
Gabrielle.
And your last name?
Mulderry.
Great. And where are we right now?
We're in the hospital.
Okay. And what's today's date?
March 9th,
Okay. What year?
2024.
Okay. It's actually September 9th, 2025, but it's okay. Do you remember the events that brought you here?
Yes, I woke up and I felt weak on my left side, my left arm, and my speech didn't sound too good.
Ah, I see. Okay. So, are you able to, with your right hand, touch your nose with your index finger? Perfect. So this is an alert patient, so we use the Glasgow Coma scale, and she receives a score of 14 out of 15 because her eyes open spontaneously. She's a little confused. She was disoriented to date, and she's able to follow commands. If she was sedated, we'd be using the RAS scale, and we would be using different methods of physical stimulation, like the trapezius pinch, the nail bed pressure, and the supraorbital notch pressing down on it. But she's alert, and we use the GCS. So her speech is pretty much fluent. She's following commands. And repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Excellent. And tell me, what is this?
Pen.
Great. And what is this?
Watch.
And what is this?
Shoe.
Excellent. Repeating is intact and naming is intact. And then to assess some cranial nerves, we're going to start with assessing the pupils. We look at it without light. Her pupils are about 3 millimeters in size and equal on both sides. We shine the light on one side, and we see constriction on both sides. On the right side, constriction on both sides, equally round and reactive to light. And then please look at my finger and follow my finger with your eyes. Do not move your head. Very good. We're going to do the H pattern here. And I don't see any nystagmus. Do you have any double vision with that?
No.
Good. No diplopia either. So some other cranial nerves, I'm going to ask you to smile, please. Symmetrical on both sides, and stick your tongue out. Good. There's no tongue deviation. The tongue is midline. So for motor, we're going to assess your strength of the arms and the legs. Can you lift your right arm for me? Good. And then don't let me push it down. Good. That's a +5, full strength. And the left arm, can you raise this? And don't let me push it down. A little bit weaker on the left arm. Can you raise your right leg? Good. Don't let me push it down. Full strength, +5. Full strength, +5. And if we wanted to assess other muscle groups, we can ask her to flex her arm and resist, or bend her knee and resist. We can also ask her to move her feet up and down if we wanted to check more in detail. So we look at the tone of her muscles. There's no spasticity. It's normal tone, and there's no flaccidity either. We're going to check pronator drift. Can you please put your arms up, palms towards the sky, and close your eyes and just hold your hands there. Okay, we see some pronator drift on the left, which makes sense because she has left arm weakness. You can open your eyes. And then we will check her reflexes using a reflex hammer. We usually just check in 3 locations mostly. We'll start with the biceps. And then we do the knees, the patella reflex. You can relax your leg. And then we check here. Good. There's adequate response, which would be a +2. And then also at the heel. The patient has to be relaxed. That was perfect. In order to elicit a response. And then we do under the foot. So And we expect to see the toes curl. Remember, if we see the toes flare upwards, then that's a Babinski reflex and it's abnormal in adults. So reflexes are normal and equal on both sides. Toes are downgoing, no Babinski. For sensory, we first assess light touch. Does this feel the same on both sides?
Yes.
Does this feel the same on both sides?
Yes.
Very good, and that's excellent. Keep your eyes closed, please, and tell me where I touched you.
Right arm.
Perfect. And what about now?
Left lower leg.
Perfect. And what about now?
Left.
Very good. So sensation is intact. No numbness. And then keep your eyes closed. Does this feel sharp or dull?
It feels sharp.
Very good. Sharp or dull?
Dull.
Good. Sharp or dull?
Sharp.
Yep. Sharp or dull?
Sharp.
Excellent. So that would be sensation to pain or pinprick. For coordination, you may open your eyes. We'll start with a finger to nose test. Take a finger and touch your nose. And touch my finger. Excellent. Touch your nose again. And touch my finger. Perfect on the right. Same on the left. Touch your nose. A little bit off and then touch my finger. Not bad, just a little slower. One more time, touch your nose. And touch my finger. Okay, coordination is good. Just a little slower on the left. Next, we are actually going to ask the patient to stand. We're going to do the Romberg test. Okay, of course, this is only applicable to critically ill patients who are able to stand or when they're with physical therapy. So keep your hands at your side, please, and close your eyes and just stand there. Make sure the patient doesn't fall. Perfect. You can open your eyes. This was normal Romberg. If she were to be swaying, that would be abnormal. And we're going to assess her gait. So if you can walk over to the wall, please, just a normal walk. Perfect. And then walk back over. Okay, she has a normal gait. Not much arm swing, but that is fine. And you can take a seat back on the bed, please. There is no ataxia. So that concludes a basic neurological assessment. Thank you for volunteering your time.
You're welcome.